Welcome to the Health Science Coach Podcast. My name is Drew Garner, and I'm a health science and physical education teacher. This is a podcast to help students, parents, and recent graduates learn about pathways into healthcare and sports medicine careers. These industry professionals lay out how their experiences have helped them get to where they are now. If you enjoy this content, please subscribe to the channel or download through your podcast player. Thanks again for spending some time with us today. Now let's dig in. Today, we get the pleasure of meeting with Gabe Pena. Gabe is a recent graduate and completed his physical therapy assistant program at Kansas City, Kansas Community College. Gabe, welcome to the podcast. How are you doing today?
Good. Thanks for having me.
Absolutely. Thanks for spending some time with us to talk about your education and, how you kind of got to where you are. Can you give us a little detail about your experience at KCK and what a physical therapy assistant does?
Yeah, so KCK, it was really helpful. It kind of helped me when I was enrolling there, that the person that was helping me enroll was actually the director of the program at the time.
Okay.
So she kind of got me set up with all the classes I needed, with all the prereqs, and all that I needed to actually get into the program. So that was really nice. And then while in the program, like all the professors are really helpful. It helps that they're small class sizes, like they only let in about 20 students every semester.
Right.
But yeah, and as far as, it's definitely hard, hard program. They had kind of a decent dropout rate just because of how hard it was to kind of get through some of the sections and stuff like that. But they definitely give you plenty of opportunities to pass those tests. Because I know with each exam we were given at least one more retry to, restudy to pass all that stuff. And that was nice. And throughout the whole 2-year program, we were given a single third chance to retake any test if we did happen to fail it a second time. So that was really nice. Never had to use that, luckily. But
Right.
But yeah.
Yeah,
But
absolutely.
yeah.
So as a physical therapy assistant, what do you guys do? Like, what was your experiences with your rotations? We'll talk more about the rotations later, but as a physical therapy assistant, what is your primary job inside of different places that you've worked in?
So yeah, it doesn't vary too much from what you'd imagine a regular physical therapist would do. The only things, as far as what we can and can't do, really is, as a PTA, you can't really do evaluations just because that requires, a physical therapy like doctorate and stuff like that. And other than that, maybe just a couple more advanced techniques here and there. But other than that, we can do pretty much anything within the plan of care that the PT sets for each of their patients. So
Okay.
usually how it'll go is, like at my outpatient, if we saw a new patient, obviously the PT would see them first, kind of get all their measurement, like how they're doing, what their issues are, what their strengths and weaknesses are, what needs to be worked on, and go from there. And then the next time they could see, either that same PT or a PTA, and they would just, like I said, work within that scope, strengthen what needs to be strengthened, work on what needs to be worked on. And as long as they're, they have a reason to do what they're doing, it's perfectly fine to do, most of anything. And then kind of same with, yeah.
You can basically do everything except for that initial evaluation with them and as well as physical.
Yeah, pretty much. And there's like a few like techniques that the state, or at least depending on the state, doesn't allow us. Like one example is like joint mobilizations. So they're like graded in like grades 1, 2, 3, and 4. As far as like the physical therapy, the board of healing arts is concerned, like as a PTA you can do grades 1 and 2, and in some states you can do 3, but in other states you can't. And PTs can do like all the grades. They can do kind of those higher, more rigorous joint mobilizations.
Yeah, that makes a lot of sense. So graduated Turner High School, class of 17. You went up to William Jewell to initially start your college career. Swimming scholarship, correct?
Yep.
Yep. So how did that transition from going from Jewell, or your time at Jewell, to wanting to go into PT school or physical therapy assistant school?
Well, initially, going into Jewel, I had thought I wanted to kind of go into like nutrition and stuff
Okay.
like that. And it wasn't until probably halfway through, so like after the first full semester into the winter, that I realized like I kind of didn't I did some more research on it really, and I just
Right.
kind of figured out it's not really what I wanted. I wanted something that was more, you know, more of a active hands-on job, and whereas being like a dietitian or a nutritionist wasn't too much like that. It's kind of more like, a desk job and kind of
Right.
that's it. And at the time I was doing some PT with our physical trainer at Jewel just because I had
Okay.
some issues, and I worked with her a few times, and I just liked the variability of what you can do with people, and like how many different ways there are to get from like point A to point B.
Right.
And like it's just a lot like going on. And then you know then I tried to switch my track onto like physical therapy, but Jewel didn't really have a great kind of track for me to go on, so I decided that it wasn't really worth staying there longer for something else. And so I just kind of transferred and kind of found a physical therapy program that would work for me, and luckily I found the one at KCK.
Yeah, absolutely. So you kind of mentioned KCK a little bit before about what you guys did there.
Yeah.
How many credit hours is it to get your PTA degree?
Oh, credit. I think before you go into the program, I think you need at least like I want to say it was about 60 credit hours, just with like
Okay.
general prerequisites like comp. I think the highest math you need is like college algebra. You need like public speaking and like a history credit and all that stuff, as well as like psych credits and all that.
Right.
But yeah,
Okay. So then while you're there, you said it was a 2-year program, right?
yes.
Okay. How many credit hours about do you take per semester during that program?
So during the program, let's see. So the way they kind of split up the program is you're technically only taking like two classes like per semester. So like my
Okay.
first semester we had clinical skills 1, which was a class that only met like once a week, and then the rest of the week we had fundamentals. And then from that after that first semester you go into clinical skills 2, and then you go into like the spine, and you just learn all the stuff about the spine. And from there you go into clinical skills 3 and into upper extremity, then lower extremity, and then clinical skills 4. Yep. And then after that, on your last semester, you go into neuro and patho, and then you do your first like a short term clinical rotation before that semester.
Okay. Okay. So that I see how it's kind of broken up per semester and by
Yeah.
skill. That's pretty cool. So while you were there, you did some rotations. Let's talk about your time spent at Lawrence Memorial Hospital.
Okay.
Your first clinical rotation, you're going into the outpatient therapy area over there. What were some of the things that you really kind of took home or really remembered as a part of that experience?
Um, that one was pretty interesting. So it was an outpatient kind of clinic, and so it was pretty small. It was more like kind of like a small town clinic. Uh, and it was myself and just the PT there.
Okay.
It was just me and him, and I mean, it was definitely something to get used to at first, because if you're not used to dealing like with patients and managing them, and because like you have this full like schedule of people you're seeing like almost back to back to back, and then
Right.
while you're working with them, doing like what they need to do, you're also like writing a daily note, on how they're doing that day, how their treatment's going, and all that stuff. But I guess what I really took away is kind of what kind of clinician I was going to be, or I am going to be, which
Right.
was I was more like technical. I was able to like, adapt to something differently and kind of just go like basically just get used to the clinic setting, which
Okay.
is which is what that rotation was really used for, just to kind of get our feet wet a little bit. And I mean, really, depending on your CI, so our clinical instructor, uh, you were either just shadowing like the full 2 weeks, or in my case, I started seeing one patient uh, towards the end of the first week, and it was a pretty simple. He was a high school student, and he had like a patella dislocation that was near near the end of being fully rehabbed. So I got to work with him a bit and kind of come up with my own plan and figure some of that stuff out. So that was really cool.
Okay. Yeah. So you were there for 2 weeks. That makes a lot of sense. Being able to just kind of step in, see how the clinic is run, learn about the different procedures and policies they have there.
Yes.
Um, your second clinical rotation was at Advanced Physical Therapy up in North Kansas City.
Yep.
Was that a 2 week one as well?
So that was a 7 week one.
Okay.
Yeah. So that was really nice. It was kind of a little hectic the first 2 weeks just because I started with a different CI than I finished with, and that's just because the first CI he had been offered like a different job opportunity, and they had known that before I was going there, so I was kind of with him, and he was kind of just like he would travel to all the clinics. So there was one in Overland Park, there was one in North KC, uh, yeah, and then there was like a third one. I forget where it was, but yeah, after that, um, I was mainly at the North one, and I was with
Okay.
a PT there. So I started with the PTA, and I got moved over to one of the PTs at the North clinic, and it was so like I said, this was like a general orthopedic, so a lot of knee replacements, shoulder repairs, low back pain, ankle issues, stuff like that. Um, what I really liked about that rotation was I learned like how to actually do like a lot of soft tissue massage, a lot of like cross friction massage, trigger point therapy, which
Yeah.
yeah, which if you haven't like done it before on like a unhealthy patient, like we definitely practiced it in class, like in lab, but it's not nearly the same as when you actually have someone who has like a really tight like IT band, and you can actually feel the tautness of it, and then once you do like trigger point, you can kind of like feel it release, which I think with the first few times it happened, I was kind of like almost shocked a bit because I
Right.
didn't expect it to do that.
That's kind of funny. Yeah, I have had some experience with, that tight IT band, and once you really feel it release, there's a big difference
Yeah.
in that feeling. Um, so you were there during that time. You got to kind of experience the outpatient portion of that with advanced physical therapy, and after that, you had your third rotation at the Kansas Rehab Hospital. How long was
Yes.
that time?
So that one was 7 weeks also.
7 weeks also. Okay. So you were going over to Topeka for 7 weeks. What kind of experience did you have there, and what kind of takeaways do you have, like stuff that you learned about how you wanted to become a PT or a physical therapy assistant, and kind of your style?
Yeah. So that rotation at KRH was vastly different from what I experienced at Advanced PT, just because it was a subacute hospital, so you're dealing with a lot of patients with comorbidities such as like heart issues, respiratory issues,
Yeah.
post COVID, um, diabetes too, and stuff like that. So yeah, it's a lot different, especially since outpatient, you people are coming because they want to come to therapy, and then sometimes you have to kind of talk patients into doing therapy in a hospital type setting, which can be kind of difficult at times but once you get used to it, you can kind of learn to navigate those situations. But there, I worked with a lot of uh, post-stroke patients,
Okay.
a lot of like TBIs, um, amputations, and stuff like that. Um, what was really interesting, I got to work with a couple patients who had Guillain-Barré syndrome, which, if you don't know what that is, it's just like there's not really like a known cause, but like it's sudden onset and it attacks like your um, ACH in your spinal cord, and basically you just lose muscle control in your limbs and stuff, and basically it gets to a point where you are completely dependent almost on a respirator, and you basically have to build all that muscle control back up. So I
Wow.
got to work with uh, three different patients that had that. So that was really interesting. It was really kind of fun to kind of find ways to work around that. And since this place was very busy, so they had I think like three different teams in the physical therapy department. And I was on like my own little team with we had a designated PT, an OT, speech therapists, and stuff like that. So that was kind of interesting because sometimes you have to do co-treatments like at the same time, and at different times of the day you have to kind of communicate because sometimes some patients will be good in the morning, but by the end of the day they'll kind of be fatigued because each patient at this hospital is getting 3 hours of PT a day or therapy a day,
Yeah.
split between PT, OT, and speech. Yeah, so it was really important with all that communication and all that, and it also helped me, especially in that setting. You have to have a lot of backup plans because you
Yep.
might have to you can look at a note and a chart and like review it, but it's not going to be the same from day to day. So you
Okay.
kind of have to be like, okay, I'm going to start with this. If this doesn't go well, I'm going to go on to this. If they're feeling tired for this, I got it. But yeah, it's just a
Right.
lot of stuff like that, but it's fun once you kind of get into it.
I think like what you were saying, learning how to communicate with those other different types of therapists and use that time effectively that you have with each patient is pretty important.
Yeah.
So we kind of talked about how you got into physical therapy or one being interested in it. You were getting treatment yourself, like you said. Why physical therapy? I mean, why not some other form of therapy or some other type of schooling to go into getting your PTA initially? Um, how do you see yourself in your future jobs being able to use and utilize your skills that you've learned?
Um, well, to answer your first, so PTA initially, well, I mean, I feel like personally I had kind of like a decent background in just, physical like exercise and stuff like that. And I mean, I was pretty good with like anatomy and stuff like that, and just, knowing how that stuff works. And I guess there's a lot of variability in this kind of field. Like I was saying earlier, like no patient's the same. You could have two different people come in, exact same like diagnosis, but they're not gonna rehab the same way.
Right.
So, it's not just, you come in like to work every day and it's the same thing. It's always something different, and you're always having to like problem solve and like come up with creative ways to, get someone better. And that's kind of the rewarding part of it at all. That's really gratifying, seeing someone go to where they can't do something to where they can do something, and that's because you had a direct impact on them.
Right.
And as far as like if in the future and like what I'm gonna do as far as this career, so one thing with PT, well, physical therapy and physical therapist assistants is um, you have to like continue doing like continue education courses, and you have to like I think it's like every 2 years when you renew, you have to have these CEU courses, done, turned in. And so what a lot of PTAs will do is they'll end up specializing in, you know, either one or a couple different areas. Like at KRH, everyone that worked there, at least in the physical therapy, they specialized in stroke, uh, TBIs, uh, and Parkinson's. So they all had taken, classes um, during their stay at there to kind of be specialized in those kind of areas, which I think is really interesting because even at Advanced PT, one of the PTAs there had just finished doing like a hand specialization. So
Okay.
she kind of had been doing courses on that to kind of, you know, learn different things to like work on people that had like either wrist or hand issues.
Right. Yeah, absolutely. So as far as physical therapy assistant, what kind of misconceptions do you think might be out there as someone that doesn't know about what a PTA versus a PT may be, or just as a misconception about PTA in general?
Um, well, the big one that I think I've heard and I've heard like other people in my class get is that just because you have that like assistant tacked on to your name, people don't think you're as capable of like treating them as a PT would, even though we're trained in a lot of the same things. Because I'm pretty sure, I think one of my classmates was with treating a patient, and uh, I forget what she said, but the patient had said something about how, "Oh, so you're not a real PT, you're just an assistant." I'm like, "No," there, and then like her CI had to like clear up all that stuff. Like, no, they went to school for this, like they're trained, like they know all
Right.
this stuff. So yeah, so it's just yeah, it's just something you gotta kind of deal with. But I mean, luckily it doesn't happen too often, and you know, people actually like do like either they won't even like think about it just because like they're there to get treatment and whatever, but like they'll like see that what you're doing is actually working with them, and they'll kind of be like, oh, like you're really helping me, you're like doing all this stuff, and it'll just kind of be like a switch in their head. But
Yeah.
yeah, see, that's
Oh,
the biggest one.
that's pretty good. Yeah, I mean that makes a lot of sense. As you were saying that, I was kind of thinking like, physician assistant or a physician, kind of the same sort of thing.
Right.
Um, as well as a nurse or the nurse anesthetist, that all kind of
Yeah,
just
yeah, yeah.
specialization and that kind of thing. So going through school and after graduation, what's something that you're most proud of accomplishing as far as getting through school?
um I say honestly just actually getting through the program, because like I said, there was like because we had heard from like the classes before, like semesters before us, like, oh, there was a decent dropout rate. Like my class, we started with 22,
Yeah.
and two of them were actually just carryover from the class above us, and we ended up finishing with 18, so we only lost four in the two
Yeah.
years. But we like I think a class one or two classes above us, I think they had like started with like 18 or 20, and they finished with seven.
Oh wow. Yeah.
Yeah, and but yeah, so that was kind of like daunting at first, but I mean, luckily like I got through it and stuff like that. Especially the last like two semesters, or I say second to last semester is probably one of the hardest, which is neuro and patho, and just because our exams were like every Friday, so we would spend like Monday through Thursday, well, in that weekend, like studying this new section, and then Friday we'd take our exam, and then after the exam we'd go over it, and then we'd get a new section, have time to look over it over the weekend, and then we have those 4 days, and like they weren't small sections either.
Right.
Like they were like packets.
Yeah. Absolutely. So if you were able to go back and do something differently through this educational experience that you've had, is there anything that you would change or maybe address earlier?
um, I'd
And
probably
this,
say.
You going just straight out of graduating high school from 17 to now?
I'd say probably just, doing more research on what I wanted to do. Like,
Okay.
I kind of went into, like, after high school, went into, like, thinking, "Oh, this is what I wanna do," without actually looking into it as much, just because I thought, "Oh, like, it sounds interesting to me, and that's what I think I'd wanna do," without actually, like, doing any, like I said, research about the job, uh, specific demands, or doing any kind of, like, internships or shadowings before. And
Yeah. Yeah, I like that idea. I mean, being able to shadow is something that's very important, and kind of help people learn about what it is to be that type of degree. Is why we're having this conversation, to help
yeah.
these future students and teach them about things that they could be looking for during their time in either high school or early on in college. We kind of talked about professional development. You talked about that and about going to different classes. Um, as far as certifications, you have your PTA certification and your first aid CPR certification. What are some of the interests that you may have of getting certified, either from CEU classes or just general interest as yourself?
Um, I wasn't quite sure yet, just because, I mean, there's obviously a lot you could kind of go into, either ranging from, a specific area of the body, being the, like spine or shoulder, or, hip and knees, to from like specific diagnoses, like I said, like stroke, or like with like Parkinson's, they have like a certification that's called like big and loud, just because for Parkinson's patients, it's really hard for them to create like these big movements, just because due to like how it's affected their
Right.
cerebellum. So there's like a special certification to be able to do that stuff. Um, I think I probably enjoy like some of like the bigger like joint stuff, like doing maybe like shoulders and hands. Like because I got to work with a few hands, not a whole lot, at my outpatient clinic, and it was really interesting just because like the big muscles and stuff, like those aren't too hard to kind of grasp. So you can kind of figure out your way around them. But then you get to like the intrinsic like stuff in your hands and like your wrists, and there's like a lot going on. So
Right.
that might be interesting to do also.
Yeah, that's pretty cool. So then career goals, you're just fresh out of school, you just graduated. Um, what are some of your career goals? Where do you see yourself 10 years from now?
Hopefully working, at in some kind of setting that I do enjoy. Um, I know in the first, uh, few years here, I'll probably, find somewhere to kind of just get experience with, and then probably eventually, after I do have some better experience, to look for like I guess, a more of a job that would suit me better, or that would
Yep.
interest me more. Then I'd like to, do that. Um, I have looked into possibly doing like a traveling PT at some point, which I think would be very interesting. Just kind of going to
Absolutely.
different places, and also kind of help me gather like more experience in different areas
Yeah,
and
I
stuff
think
like that.
that's really cool. I know as far as the nursing and nursing world, traveling nurses, they really are looking for those people that have at least 1 or 2 years of experience for the most part,
Yeah,
because you are getting into a setting where you have to know the procedures of the floor that you're on and that kind of stuff. I'm sure
yeah,
it's
definitely.
kind of somewhat similar for that, but I think being a travel PTA at a younger age, you don't have any responsibilities to
Yeah.
anybody but yourself. I think that'd be really cool to be able to do. Um, what do you wish you would have known while you were in high school, other than like what you talked about doing some job shadowing and looking at different careers in demand? Um, what's something you wish you would have known in high school that you think could help you in your career now?
Um, I'd say probably just what it actually takes to get to that, that end goal, that career that you want. Because
Mhm.
like coming out of like in high school, I guess like you're not. I don't want to say you're not pushing yourself to like get through high school, but you you're kind of on a routine from like a very young age. You go to school and it's kind of like what's expected of you. It becomes normal. But like once you get out, like the only one that's gonna like really like push you is gonna be you. Like you might have people like telling you, oh, you should like do this and do this. But at the end of the day, it's your choice. Like you have to want to do something and you have to know how to get from like point A to point B and what you need to do, what kind of classes you need to take and stuff like that. So
Yeah.
I mean, if I would have liked to like have known some kind of, or at least have some kind of grasp on what it takes to get to that end goal.
Yeah, absolutely. So then, as far as advice for a high school student, let's picture one of my kids, that's a junior or a senior, one of my students that says, I want to be a physical therapy assistant. What are some things that you would want to, or bits of information you would want to tell them about either school or what they should be doing in high school to help prepare them to get ready for that?
Um, well, probably the most important thing is just research. Make sure it's what you want to do. Make sure that you're gonna want to do it in the long run because I mean, the end goal, like I said, it's gonna be your career. It's what you're gonna be doing every day. So, shadow, do all that stuff. Make sure that it's something that you actually want because, you know, a lot of people when they're thinking about like jobs, they see it at like a surface level, but they don't see kind of like all the small, like nitpicky stuff that you have to do. Like for
Right.
physical therapy, it's like doing daily notes. So you have to every single patient you see in that day, you have to write a note about, how they're doing, what you did in that session, why you did it in that session, what you want to do next time, and stuff like that. So that's, this is it's like paperwork. Like
Yeah.
no one sees paperwork, but they see like people like doing jobs.
Yeah.
So
No.
yeah, just say yeah, make sure it's something you want to do.
Uh, Next part of advice is for that freshman in college, somebody that's just started KCK or another program for PTA, but they're in school, they're just starting the program. What kind of advice would you have for that student?
Um, I'd say really just figure out how you learn, figure
Okay.
out like what works best for you because definitely during this program I had to figure that out for myself. I had to figure out the best way that I learned this material, which it's as far as like the material in the program, some concepts are hard, but once you get them, it's not too bad. The real thing with knowing this stuff is memory, just because there's such an abundance of information you have to take in, not a whole lot of time. But, you know, whether it's, learning with flashcards, whether it's literally memorizing what's written on every single page or memorizing concepts or something like that. Uh, yeah, so figure out the best way you can learn because, I mean, no one knows you better than yourself. So, lean on your strengths, try and work on your weaknesses, but just try and figure out what you can do to better get you to where you want to go.
Yeah, absolutely. So then you had to, after you graduate or took all the classes, you graduated, you had to take a exam to become certified, right?
Yep.
So you have your physical therapy assistant certification exam. What advice would you have for a student that is preparing to take that test?
Um, so the program itself does pretty good about prepping you. So like right after we finished our final rotation, uh, the very week after we had like a board prep week where we just kind of reviewed everything from musculoskeletal to uh, diseases and pathologies and stuff like that, and clinical skills kind of stuff, just to kind of help us
Hmm.
prepare. And they actually give you a prep book that's included with like the tuition and stuff like that. But other than that, just make a schedule for yourself, because after that like board prep week, it's really easy to not want to study.
Yeah.
So you kind of gotta, set aside time to, I'm gonna study this section today, study this section tomorrow, review that section the next day, have a rest day, and then, start again up until boards. Because I had to
Yeah.
wait a good 3-4 weeks to take those boards, and
Okay.
it was a long 3 weeks.
Yeah, I can imagine, especially, after already graduating and taking all the classes, you have to wait that time to go take another test, and then study everything that you've learned over the last 2 years. Um, so yeah, you passed, you got your certification, everything's awesome. You finished that up. During your time in school and while you were doing your rotations, was there any specific type of modality therapy that you liked to use, or maybe a piece of equipment that you thought was really cool?
Oh yeah. Let's see. So yeah, I got to use actually a lot of different modalities at advanced physical therapy. So at least a couple of different times a day, I would use a lot of like e-stim, so electrical stimulation for patients, or ultrasound, and let's see, like it's called like low-level laser therapy,
Yeah.
which just kind of helps with like inflammation, chronic or acute pain, and stuff like that. So that was very interesting. And then yeah, just a lot of hot packs, cold packs, stuff like that. But yeah, I'd say e-stim is probably one of my favorites.
Yeah, absolutely. I had the chance to use that quite a bit when I was in
Yeah.
college as a pitcher, so I know exactly what you're talking about. So then, um, somebody that's getting ready and interested in being a physical therapy assistant, is there any type of book that you might recommend to somebody to learn more about the profession?
Look, I don't know about a book specifically, just
Or one
because
of
it's
the had in class that you thought was good?
oh, there's a lot. I don't think about studying those too much, but uh, because it's so vastly different from reading it to actually doing it.
Right.
Uh, but yeah, I mean, I don't have like a specific book, but I'd say, like I said before, do some research on it, find a place to shadow at, because like that's where you'll get the most out of what you'll do in this career. Uh,
Right.
Finding someone else who's already doing it, or can kind of explain how it works, probably going to be
Mhm.
the best way for you to kind of figure out if it's for you.
Yeah, absolutely. So then, two more questions, and I know you got stuff to do later on the rest of the day. Um, so our trainer here at the high school, Linda, you know her,
Hmm.
she kind of came up with this question for us. It's if you like or if you dislike blank, then this is not the right career path for you. So as an athletic trainer, she said if you dislike feet because of all the feet taping and ankle taping and that kind of stuff, this is not the career path for you. So far in your experience, if you dislike blank, being a physical therapist assistant is not the career path for you.
It's probably a few things. If you're not a people person, because you definitely will have to, make small talk from time to time with patients, and depending on the setting, some of those patients will kind of go on, and you basically just have to be there and listen and respond and stuff like that. Um, any kind of physical contact, because you do have to do a lot of hands-on work.
Right.
Uh, but
Yeah, that makes a lot of
yeah.
sense. So to bounce off of that, if you do like blank, then being a physical therapist assistant might be the right career path for you.
I'd say like problem solving, honestly,
Yep.
because like I said, there's a lot of different things, different patients, different diagnoses, uh, different pathologies you have to work on from a day-to-day basis, and none of them are going to be exactly the same. You're going to have to come up with creative ways to get someone to do something, whether it's something as simple as getting out of bed to climbing up on a stair, and you're going to have to work on progressions, regressions, seeing like if this, like, they could be perfectly fine with walking 100 feet one day, but then the next day they maybe can't do as much. So you kind of got to shift your attention to what's going on with them that day and kind
Right.
of base it around that.
Yeah, absolutely. Being able to adapt and change in any type of hospital situation, physical therapy type setting is very important.
Right.
So then, last question I have for you is: if you have a mantra or quote that you kind of live your professional or will live your professional work life through.
um I'd probably say that like just because like if you stumble, there's like something in your path, something like that, an obstacle, like, and you end up failing, like it's not the end of the road. Like, keep on going. The only
Yeah.
thing that's gonna make you fail is you. So as long as you don't stop trying to get to where you're going, like it might take a little longer than you expected. It might not you know be the exact path you imagine, but you're gonna get there. You're gonna get somewhere, and
Right.
that's better than where you are after that failure.
Absolutely. Gabe, really appreciate your time today. Thank you so much for coming on and talking to us about your experiences at KCKCC and physical therapy assistant program there. We really appreciate it.
All right. Thank you very much.